Welcome to this deep dive. Today we're really focusing in on Palladia. That's tesserainib phosphate. It's become a really important medication when we talk about treating cancer in dogs.
It really has.
And we know just hearing about cancer treatment for your dog, it can feel like just so much information coming at you. It's overwhelming.
Absolutely. It's a lot to
Right.
take in.
So our goal here is really to, try and cut through some of that noise and give you some clear, hopefully helpful information about Palladia.
Makes sense.
We want to look at what it is, what side effects you might see, how you can actually watch for them, maybe some ways to manage those side effects, and also, importantly, diet during treatment.
Yeah, diet's a big one people ask about.
Exactly. We've gone through the research trying to pull out what's most crucial and, always with that sense of care for your companion.
Right.
Yeah.
Let's get right into it then. Palladia itself, it's pretty interesting. It's what we call a tyrosine kinase inhibitor, or TKI for short.
TKI, okay.
And what's really notable is that it was actually the first drug that got specific approval for treating mast cell tumors in dogs.
The very first one. Wow.
Yeah. And it works differently than, say, traditional chemo. It's designed to be more precise.
Precise. I like that word. So how does it manage that? How does it target the cancer cells specifically?
Okay, so think of it like this. Cancer cells often have these like specific on switches, right? Telling them just grow and divide like crazy.
The controlled growth, yeah.
Exactly. Palladia is kind of like a specialized tool designed to hit several of those key switches at the same time. These switches are proteins, receptor tyrosine kinases,
Okay, so it's hitting multiple targets.
multiple targets. Some important ones are VEGFR, that's vascular endothelial growth factor receptor. Tumors need that to build blood vessels to feed themselves.
Ah, cuts off the supply lines?
Kinda, yeah.
Yeah.
It also hits PDGFR, which is involved in cell growth, and really importantly for mast cell tumors. KIT, that one's often mutated or just overactive in those tumors.
So that directly drives the mast cell cancer.
It's a major driver, yes. And there are others too, like colony-stimulating factor 1 receptor and MMS-type tyrosine kinase 3. So the idea is, by blocking these specific pathways, you slow down or maybe even stop the cancer.
And because it's hitting these specific molecular switches, the hope is less collateral damage to healthy cells compared to older chemo.
That's exactly the idea. More targeted, potentially less harsh on the healthy normal cells that are also dividing. But it's still really important to remember, Palladia usually isn't seen as a replacement for surgery. If you can remove the tumor surgically, that's often still the primary step.
Okay, that's a key point. Surgery first, if possible.
Generally, yes.
So if the vet does recommend Palladia, how is it typically given? What's the schedule like?
Usually the standard schedule is giving the tablet every other day.
Here.
But, and this is really important for you to know, the vet will often need to tweak that dose.
Ah, adjust it based on the dog.
Exactly. Based on how the dog is responding, how they're tolerating it, any side effects they might be showing. So that close monitoring and communication with your vet, absolutely vital.
Constant feedback loop, basically.
You got it.
Now, we mentioned mast cell tumors as the main target, the approved use, but you hinted it might be used for others.
Yeah, absolutely. While mast cell tumors are the official label indication, the research and clinical experience we have suggests Palladia shows promise for quite a few other canine cancers too.
Like what, for instance?
Well, the list includes things like Agasaka, that's a pocket gland anal sac adenocarcinoma, bit of a mouthful.
Definitely.
Also chemodictomas, GISTs, gastrointestinal stromal tumors, some head and neck carcinomas, inflammatory mammary carcinoma, insulinomas, nasal carcinomas, pheochromocytomas, thyroid carcinomas, and even transitional cell carcinoma, which affects the bladder.
Wow, that's actually a pretty broad range beyond just mast cell tumors, shows its potential.
It really does highlight how versatile these targeted therapies can potentially be.
Okay, so we've got a good handle on what Palladia is, how it works, and where it might be used. Let's shift gears to something that's understandably a huge concern for pet owners.
Yeah.
Side effects.
Right. The big one.
What are the main things people need to be really watchful for at home?
Vigilance is definitely key. The information points quite clearly to gastrointestinal issues being the most common things you'll see.
Okay, like tummy upset.
Exactly. We're talking diarrhea, maybe vomiting. Sometimes you might even see blood in the stool, or just, your dog isn't interested in food,
Yeah.
decreased appetite.
Any of those signs, call the vet.
Definitely. Don't wait. Prompt communication is crucial.
Okay. Those seem like things you'd probably notice. Are there other, maybe less obvious changes to be aware of?
Yes, absolutely.
Mm.
Beyond the GI tract, there are other things to monitor. Hypertension, high blood pressure can develop.
Oh, interesting. Do you check that at the vet?
Yes. Regular blood pressure checks are usually part of the monitoring protocol. Also, proteinuria, that's protein showing up in the urine. Muscle pain is another one.
How would that look? Like stiffness?
Yeah, maybe stiffness, reluctance to move. Maybe they seem like they're having muscle cramps.
Mm.
And then there are sometimes changes in their coat or skin pigment.
Like the color changes?
Yeah, maybe their nose gets lighter or patches of their fur change color. It's kind of interesting. Sometimes those subtle things are clues.
Huh. And what about things that wouldn't be obvious at home? Things that only show up on blood tests?
Good question. Regular blood work is super important with Palladia. There are definitely things the vet looks for that could signal a need to uh, pause the medication temporarily.
Like what kind of things?
Things like anemia, which is a drop in red blood cells,
Oh,
or a drop in neutrophils. They're a type of white blood cell important for fighting infection.
so immune system impact.
Potentially, yeah. Also, an increase in kidney toxins in the blood. That's called azotemia, or elevated blood phosphate levels, or maybe a drop in blood albumin, which is a key protein.
So the vet is tracking all these levels closely.
They should be, yes. Regular blood tests are standard procedure.
Okay. And are there any other side effects? Maybe less common, but still worth knowing about.
Yes. A few others have been reported, though they seem rarer. Things like muscle cramping, which we touched on, pancreatitis, inflammation of the pancreas, and sometimes liver toxicity.
So lots to potentially keep an eye on.
It sounds like a lot, but again, open communication with your vet team means they can manage things if they arise.
Right. So knowing what to watch for is step one. Step two is, can we do anything to prevent or lessen these side effects?
That's a great question. And there is some sort of anecdotal evidence or experience from vets suggesting a proactive approach might help, especially with the GI stuff.
Oh, like what?
Giving a short course, maybe say 4 to 7 days of things like antacids, maybe carafate, which coats the stomach lining, and possibly an anti-inflammatory before you even start the Palladia.
So prepping the system beforehand.
Kind of prepping the gut, yeah.
Yeah.
The idea is it might minimize those initial GI side effects for some dogs, but definitely that's something you need to discuss specifically with your veterinary oncologist, see if they think it's appropriate for your dog.
Makes sense. A tailored approach. What about managing things like the high blood pressure if it develops?
Well, as we mentioned, regular blood pressure checks are key. If hypertension is detected, the vet has ways to manage it, often with medication or other support.
Okay.
Really, the main principle here is just report everything. Any change you notice, any concern you have, tell your vet right away. They can then figure out the best way to handle that specific issue for your dog.
Got it. Communication is everything.
Absolutely.
Okay, let's talk about diet. Nutrition is always important, but does it become even more critical or maybe need specific changes when a dog is on Palladia or fighting cancer in general?
Yeah, diet is definitely something people focus on, and for good reason.
Ah,
While there isn't one single cancer diet that fits every dog, there are some general principles that often come up as being supportive.
such as?
Often the thinking leans towards a diet that's higher in good quality. Lean protein helps maintain muscle mass, which can be a struggle. Moderate amounts of healthy fats are usually good too, especially omega-3 fatty acids,
Like from fish oil?
fish oil, krill oil, things like that. And then potentially being mindful about the amount of simple, starchy carbohydrates.
Ah, the carb debate. Why limit carbs?
Well, the rationale often discussed is that cancer cells seem to really love glucose, simple sugar for energy. They gobble it up. So the idea is maybe don't provide an overabundance of easily accessible fuel for them.
Limit the easy fuel source. Okay. So if you are including carbs, what kind are better?
If you're including carbs, the preference is generally for complex carbohydrates from sources like non-starchy vegetables, maybe some fruits. They provide fiber, which is good for the gut, and lots of beneficial phytonutrients.
Plant compounds, yeah.
Exactly. Things with antioxidant or anti-inflammatory properties.
Are there specific foods that often get recommended as being particularly good additions?
Yeah, several things tend to pop up. Lean proteins, like we said, chicken, turkey, fish are often mentioned. Though, quick caution, with mast cell tumors, sometimes fish needs care because of histamine release potential.
Good point. Histamine and mast cells.
Right. Cruciferous veggies, think broccoli, cauliflower, Brussels sprouts, they contain sulforaphane, which has shown some interesting anti-cancer activity in lab studies.
Okay, what else?
Certain mushrooms, especially medicinal ones like turkey kale, get a lot of attention for potential immune benefits. Big caveat, though. They need to be cooked properly to unlock those benefits.
Raw mushrooms aren't the way to go then.
Generally not for medicinal properties, no. Sardines are often mentioned, great source of those omega-3s, and berries, blueberries, raspberries packed with antioxidants and phytonutrients.
That's a good list of things to potentially add. What about things to maybe limit or avoid?
Well, as we touched on, limiting those really starchy, highly processed carbs is usually advised. Also, being mindful of the balance between omega-6 and omega-3 fatty acids.
Too much omega-6 isn't great.
Yeah, the typical Western diet, even for dogs, can be very high in omega-6s, often found in corn oil, vegetable oils. You want a better balance, leaning towards more omega-3s.
Okay. What about cooking methods? You mentioned that earlier.
Right. This is interesting. High-heat cooking methods like grilling, smoking, heavy roasting, they can create compounds like heterocyclic amines and acrylamides.
And those are bad.
They are considered potential carcinogens. So gentler methods might be better, things like microwaving, steam roasting, maybe infrared grilling if you have one. The idea is to cook the food safely, but minimize creating those harmful byproducts.
That's fascinating. I hadn't thought much about cooking methods like that. What about really extreme diets people might try, like super low fat or making everything homemade without guidance?
Yeah, you have to be really careful there. Extremely low-fat diets aren't usually recommended unless there's a specific medical reason, like pancreatitis, because dogs need essential fatty acids.
Right.
And unbalanced homemade diets, if you're just kind of winging it, that can easily lead to serious nutritional deficiencies. If you do want to go homemade, it's best to work with a board-certified veterinary nutritionist to formulate a complete and balanced recipe.
Get expert help for homemade.
Definitely. And for commercial foods, look for that AAFCO statement. It basically says the food meets minimum nutritional standards.
Good tip.
And remember, any diet change should be gradual. See what your dog likes, what they tolerate, what fits your budget and time. It's about making improvements, not achieving some impossible perfection, especially when your dog isn't feeling their best.
Gradual changes. Focus on well-being.
Hmm.
Got it. This is all incredibly helpful. Now, switching gears slightly, but still crucial safety. Since Palladia is a potent drug, what precautions do owners need to take when handling it?
Yes, super important topic. Safety first. Because it's a chemotherapy agent, essentially you need to handle it with care. Always, always wear disposable gloves when you're touching the tablets.
Gloves every time.
Every single time. And don't break or crush the tablets. They have a special coating for a reason, partly for proper absorption, partly for safety.
Okay, don't break them. What if the dog spits it out or it gets wet?
Still use gloves. If it's spat out, put gloves on to pick it up and try again. Or dispose of it safely, according to your vet's instructions. Same if it gets wet, glove up to handle it.
And what about after the pill is given? Thinking about the dog's waste.
Critical point, yes. The drug and its metabolites can be excreted in the dog's waste, so you absolutely must wear protective gloves when handling their stool, their vomit, or their urine while they're on Palladia.
Gloves for cleanup, too. Okay, how should you dispose of that waste?
The recommendation is to seal it well, put it in a plastic bag, tie it, then put that bag inside another plastic bag, tie that one too, and then dispose of it in your regular household trash. Double bagging.
Double bag it. Got it. What about washing things, like bedding or towels?
If any laundry items get contaminated with the dog's waste, urine, feces, vomit, wash those items separately from any other household laundry.
Separate wash. Makes sense.
And one more really vital point.
Mm-hmm.
Certain people should avoid handling Palladia altogether if possible. This includes women who are pregnant or breastfeeding, anyone who is immunocompromised, and children.
Okay, that's very clear. Keep it away from vulnerable individuals.
Exactly. Safety precautions are non-negotiable with these kinds of drugs.
Absolutely. Now, we've focused mainly on Palladia as the conventional treatment, but we know a lot of owners are interested in or already exploring complementary or integrative therapies alongside it.
That's very true. It's a common area of interest.
Can you touch on that briefly? What kind of things do people consider?
Yeah, some of the things mentioned in the sources that often come up are medicinal mushrooms, like we discussed earlier in the diet section, turkey tail being a popular one. There's research looking into their immune-supportive and potential anti-tumor effects.
Okay, mushrooms. What else?
CBD oil is another one that gets a lot of discussion. There's ongoing research into its potential anti-inflammatory effects, and some preliminary studies hinted possible anti-cancer properties as well.
Interesting. But I sense a but coming.
A very big but. It is absolutely crucial. I can't stress this enough, that you discuss any complementary therapy, whether it's a supplement, herb, mushroom, CBD, whatever, with your veterinarian or veterinary oncologist before starting it,
Why is that so critical?
because there can be interactions. Some supplements could potentially interfere with how Palladia works, making it less effective, or maybe even increasing side effects.
Hmm.
Or they might interact with other medications the dog is on. Your vet needs the full picture to ensure safety and coordinated care.
Don't accidentally counteract the main treatment.
Precisely. Or cause unexpected problems. Open communication about everything your dog is receiving is key.
Okay, so always discuss integrative options with the vet first.
Always.
This has been incredibly thorough, thank you. If we were to boil it down, what are the absolute key takeaways for someone listening whose dog might be starting Palladia or is already on it?
I think the main things are, first, understand basically how Palladia works. It's a targeted therapy.
Yeah.
Second, be super vigilant about watching for those potential side effects, especially the GI ones, but also the others we discussed. Know what to look for.
Vigilance, yeah.
Third, communicate everything to your vet promptly. Don't wait if you see changes. Fourth, think about supportive care, like diet, but always discuss major changes with your vet. And fifth, follow those safety precautions for handling the drug and waste to the letter.
Handle with care.
Absolutely. And underpinning all of that is maintaining that strong, open relationship with your veterinary oncology team. They're your partners in this. They have the expertise tailored to your dog's specific situation.
That relationship is crucial.
It really is. Navigating cancer treatment is tough. It requires a lot of attention, a lot of informed decisions. But understanding the tools like Palladia, being prepared, and working closely with your vet gives you the best chance to provide great care.
Thank you so much. That's really clear, compassionate guidance on a complex topic. We genuinely hope this deep dive has given you, our listeners, some valuable information and support as you navigate this journey with your dog. We're definitely sending strength to you and your furry family.
Absolutely. All the best.
And with that, we'll wrap up this deep dive.